I'm outside the patient's room. I'm verifying provider's order and the care plan. I'm also maintaining standard precautions. Knock, knock. Hi, my name is Malarmi. I'm a nursing student from Nevada State College. I'm here with my professor, Professor Cordova. And before I get started, can I have you state your name and date of birth? Okay, and can I check your wristband ID? All right, thank you. And it does match your form here. And do you have any allergies? Okay, thank you. And is it okay, Mr. Wayne, if I might take a seat so I can discuss your treatment plan? All right, thank you. And Mr. Wayne, I have an order from your provider for a tracheostomy suctioning as well as a tracheostomy care. What that is I'm going to be inserting a tube down your tracheostomy. I'm going to suction and clear out the secretion and the mucus so that it helps you breathe better and also to provide a patent airway for you. Okay. All right, first is I'm going to go ahead and raise the bed to a working height, my working height. I'm going to elevate the patient's head of bed to a semi-Fowler's position. I'm going to go ahead and turn on the regulator, set the regulator to between 80 to 120 millimeters of mercury. And I also am going to set the suction tube that is attached there. I'm going to keep it on the side. And I also have my equipment here. I have my tray, a catheter tray along with my sterile gloves. And it does have also, I have my normal saline here and also a container. And I'm gonna go ahead and perform hand hygiene first. And first things first is I'm gonna go ahead and assess my patient. I'm gonna go check the patient's vital signs. I'm gonna check his respirations. I'm gonna listen to his lungs. Okay, Mr. Wayne, take deep breaths. Okay, I'm also checking at the back. Okay, Mr. Wayne, I do really hear some adventitious sounds, so definitely we need some suctioning here. So I'm gonna go ahead and prepare my equipment here. I'm gonna go ahead and perform my hand hygiene. And I do have my tray and my gloves, just making sure my tray is not expired. And I'm going to go ahead and open my normal saline. I'm gonna go ahead and pour out and put some on my container. And then I'm gonna go ahead and open my container away from me. And at the same time, I'm gonna go ahead and open my gloves. I'm only making sure I'm touching the outside border of only 1 inch around the border. Okay, with my non-dominant hand, I'm gonna go ahead and grab and put this on my dominant hand. And then using my fingers to cuff, I'm going to put the other glove. Okay, I'm going to raise my hand on, cuff my hand like this. If I put my hands below my waist, it will be breaking the sterile field. All right, so I'm gonna go ahead and grab my catheter. Just checking to make sure there's no kinks or holes. And I'm just gonna hold it onto this hand on my sterile hand. And then on my non-dominant hand, I'm going to remove the mask. And I'm gonna go ahead and I have an ambu bag here. I'm gonna go ahead and give my patient a couple breaths. 1, 2, and 3. All right, and then I'm gonna go ahead and have my suction tubing here attached here on my end of my tube. Now my hand is no longer it's no longer sterile. My non-dominant hand is only holding the valve here, and I cannot touch the tubing because the tubing is sterile only on my sterile hand. And I'm gonna go ahead and just test out the suction to make sure it's suctioning pretty well. And I do show that it's going through. So I'm gonna go ahead and ready to go in my first pass. And then again, my thumb is up on this section, and then I'm gonna go down to the patient and inserting the tube between 10 to 12 centimeters until I hit resistance. And then once I hit resistance, I pull back 1 centimeter back, and now I can start suctioning and providing intermittent suction while I'm also encircling and rotating the tube out. And I'm checking the patient's vital signs on the screen. I do show that it's not normal, it's not within normal range, respiration still up, and the SpO2 is still low. So I'm gonna go ahead and make another pass. So I'll do that. I'm gonna go ahead and clear out my tube. I'm going to clear that out with my normal saline, suction it out. And then I'm gonna go ahead and make a second pass. So with my thumb up, I'm going to go ahead and insert my catheter here to 10 to 12 centimeters until I hit resistance. And then once I hit resistance, I'll pull back 1 centimeter, and then I can go ahead and start on and off while rotating and circling. All right. And then I'm going to go ahead and check again for my patient's vital signs to check to see. Now it looks like it's going great. Patient's vital sign respiration is already in normal limits, and SpO2 is at 98%. So there is no more suctioning needed at this time. So I can go ahead and throw my equipment. So I'm going to remove my gloves along with my catheter. So I'm gonna go touch the inside first, and then at the back, I'm going to only, from here, I'm gonna go ahead and grasp the inside like a bag. I'm gonna go ahead and throw that on the proper disposal. I'm gonna go ahead and clean my area here. I'm gonna go ahead and throw this in the proper disposal. And I'm gonna go ahead and perform my hand hygiene. And now I am perform another hand hygiene here. I'm ready to do my tracheostomy care. Again, perform another hand hygiene here. You can never be too clean. And then I have my tracheostomy tray care kit here. Now on this one, I'm just gonna check to make sure that the packaging is current and valid and it's not expired. And then at the same time, I still have my normal saline here. And I can go ahead and start put my normal saline on my container. Again, I'm gonna go ahead and perform hand hygiene. And I'm gonna go ahead and open the tray away from me. Okay, and so I'm gonna go ahead and move this here. I'm gonna go ahead and grab my sterile gloves. Then I'm gonna go ahead and cuff that. Okay, I'm gonna keep that above my waist level, and I'm gonna go ahead and grab my drape. Okay, and then I'm gonna go ahead and put my contents into the middle of my sterile field. Okay, and so I'm gonna go ahead and come out here. I'm gonna go grab my normal saline, and then I'm going to put I'm going to open my cap, and then I'm going to put my cap down facing up. I'm going to be putting my solution here on this bucket. So I have 2 buckets here. I'm going to put solutions in there. And then I'm going to go ahead and ready to remove the lock from my patient's trach. So I'm going to go ahead and unlock my patient's inner cannula. So with my non-dominant hand, so I'm going to unlock it, twist it. I'm going to remove the cannula down and on the side. And then I'm only touching the outer portion of this cannula. The tubing is considered sterile, so I'm only touching the outer portion. I'm gonna go ahead and drop that here on my bucket. And then I'm gonna go with my sterile hand, I'm gonna go ahead and grab a brush. And I'm going to go ahead and grab these. And then I'm going to clean my cannula and making sure that my 2 hands are not touching together. So I'm gonna go ahead and clean, clean, clean. And then I'm going to go ahead and put that brush down. I'm gonna go ahead and grab again just the outer portion. I'm gonna rinse it. I'm going to tap it. And then I'm gonna go ahead and put it back here, twist it and lock. And this time, this is no longer a sterile procedure, so I can move my hand. Okay. And then next one I'm gonna do is I'm gonna go ahead and wet my cotton tips here, pre-moist. Okay, let's see. I'm going to pre-moist my tips, and then I'm gonna go ahead and clean around the outer cannula. I'm going to clean around the plate here, toss that. I'm going to clean the one at the bottom as well. I'm going to toss that. And with my 2x2 gauze, I'm going to wet, and then I'm going to clean the plate. So I'm going to clean the plate, the outer plate here on the side, right here on the side. Throw that, and then I'm going to go ahead and clean around it. And while I'm cleaning, I'm also assessing the patient's skin and make sure the stoma is not infected or any signs of infection. I'm gonna go ahead and throw that. And then I'm gonna go ahead and put my fenestrated drape. So how I'm going to put it, I'm going to put it like this on the side. I'll be inserting here on the side first. At the same time here as well, like that. And then at the same time, you can put the holder or the new tie around the patient. However, I only have 1 tie, so if you do have extra, you may go ahead and make a new tie. And make sure when you remove the tie is you're gonna have to keep the old tie, but you're gonna put the new tie first and keeping the old tie. All right, and we are done with that. So I'm gonna go ahead and put back my patient's mask, and I'm going to be disposing my gloves. And I'm gonna go ahead and perform hand hygiene here. All right, and then I'm going to go ahead and bring the side rail up. I'm going to go ahead and lower down the bed to the lowest position. I'm going to provide the patient a call light within reach. And Mr. Wayne, we are finished here. How do you feel? I understand. What I'm going to do is I'm going to come back within 1 hour to check on you to see how you're doing. Do you have any questions? No? And I'll be disposing my materials here on the proper receptacle. And again, I'll be performing hand hygiene. And then I'll be documenting outside the patient's care that I provided and the patient's response to care. Thank you.